All right, guys, we are making sure you know everything about the coronavirus and its impact to your health. We had Dr. Ben Springate answering your questions earlier this morning, and now we have Dr. Fred Lopez, an infectious disease specialist with LSU Health. Hi, Dr. Lopez. It's good to see you.
You too, Sheba. How are you?
Good. Let's dive into these questions. Someone's asking how much testing is needed for doctors to be satisfied that enough testing is happening.
Well, we want more tests. There's no doubt about it. Part of reopening America and in our societies is going to revolve around testing. We're going to need to be able to set up safe, efficient testing sites for anybody who's symptomatic with COVID-19 like symptoms. And we're going to need to be able to test their contacts in order to determine whether they're infected as well. We'd like to be able to make diagnosis of active infections, and we'd also like to be able to do surveillance testing. In other words, taking people who aren't just symptomatic, but also asymptomatic and finding out whether they're infected or not. We're already finding out that 25% of some communities include individuals who are asymptomatic but test positive for the virus. And all of these testing strategies that I'm talking about address active infections. We also want to get really reliable antibody testing in place. Right now, everybody's talking about these antibody tests. There are a few that are approved under emergency use authorization by the FDA, but they need to be validated. And when they become validated and are reliable, we're going to be able to identify people who are immune to the infection and who don't have to worry about getting infected again, at least for a short period of time, making them less vulnerable. So all kinds of testing is important, but we need to have it in place because that's going to be amongst the linchpins, if you will, for reopening our communities.
All right, and then speaking of reopening, which could happen very soon, people who are older and at higher risk, someone is asking if they should still stay home even after things reopen.
Absolutely. That's one of the also inherent features of moving forward is going to be making sure that all vulnerable patients shelter in place and conclude physical distancing within their shelters as well. Remember, vulnerable people are those who are older, typically defined by older than 60 years of age, and or have underlying medical problems that are chronic, like kidney disease, lung disease, heart disease. All of those really increase the risk for more serious infections, and any individuals who meet those criteria really are going to need to continue to shelter in place while we're reopening our communities.
All right, Dr. Lopez, glad to have you with us again today. Thank you so much.